Thank you for your interest in the SmartScreener-Plus 2 newborn hearing screening system. SmartScreener-Plus 2 is a cost-effective, complete, and easy-to-use infant hearing screener. Our system offers you a choice of automated ABR screening, OAE screening, or both on the same device. The device is simple to operate with step-by-step visual instructions for the operator, as well as friendly voice prompts that guide the user through the screening process. It is a fast, reliable, and accurate system that can be used to test patients of all ages. The SmartScreener-Plus 2 is a highly ergonomic solution with an integrated equipment, computer, and workstation card configuration. The workstation is designed to be baby-friendly, allowing for testing at the mother's bedside. SmartScreener-Plus 2 is compatible with Windows 10 and features an integrated data backup utility that allows for the seamless transfer of results to central databases such as those used by state EDI programs. Customize various options to meet your hospital's needs, including the patient demographics module. Program administrators can set up different users with varying password-protected access levels. We also allow the program administrators and advanced users to set the testing intensity and set up multiple testing levels. SmartScreener-Plus 2 provides newborn hearing screening programs with the ability to play multilingual informational videos to guide the parents through their screening process right on the screening device, and to print patient information brochures for parents to educate them on the exam. Forms and documents can be customized by the hospital and made available in multiple languages using the Documents and Video module. The highly ergonomic screener cart is designed to be baby-friendly and is ideal for testing at the mother's bedside. The cart, as you see here, ships pre-assembled, and so there is no assembly required. All you need is slide the laptop in and place the printer on the shelf if you choose to use a printer. The SmartScreener-Plus 2 device is PC battery operated, allowing for testing even when there is no access to an outlet, which also reduces electrical interference. This is particularly useful in NICUs and busy nurseries where access to an outlet can be difficult, as well as when testing in the mother's room. On the top of the cart, you will see an ample work surface with raised edges and a document cover. The blue button on the top of the cart is a light that illuminates the keyboard, which makes it easier to work in low-light locations such as the mother's bedside without disturbing the baby. The notebook computer and the device are safely installed in the key lock technology tray compartment underneath the top surface. The screener cart features contoured front and rear handles for easy maneuverability. This allows the cart to be easily wheeled around the hospital, even over elevator thresholds for added convenience. Further down, you will find the screener cart's integrated keyboard and mouse surface. The screener cart has smooth, non-porous surfaces for easy cleaning, infection control, and durability. Even the keyboard is washable. On the back of the cart, you will notice the ample built-in bins to store all supplies and documentation. A coiled power cord and hook allow for easy and safe cable management. There are also hooks on the side of the cart to store the patient earphone and electrode cables. The screener cart comes with a convenient height adjustment. Using the blue lever on the right side of the cart, each user can easily set the height adjustment to a comfortable level, even using it in a seated position. The screener cart also comes with a convenient wheel locking mechanism. While you may not be able to see it, the cart has a built-in isolation transformer at the base. Integrated laser printer for fast, reliable printing at bedside can be seen on the shelf. SmartScreener-Plus 2 is used with our baby-friendly over-the-ear ear hug disposable couplers. The ear hug is designed with the baby's comfort in mind. A special flexible material adheres to the skin firmly and is gentle enough for discomfort-free removal. Ear hugs are cost-effective, which translates to savings on every screen. The comfortable design allows the baby to easily fall asleep even when lying on the ear hug. Unlike other disposable couplers that only have adhesive on the rim of the cup, the ear hug's large adhesive surface keeps the ear hug from detaching during testing. It attaches securely to the baby, even to skin with hair. Yet, it is gentle enough for comfortable removal. It does not pull away any of the hairs when you take it off. The automated ABR module allows for simultaneous testing of both ears using a 35 dB HL click stimulus. After a fast midline ABR recording electrode setup, screening results can be obtained in as little as 2 minutes. The electrode placement and impedance values are shown on the screen. The automated OAE module allows for testing using DPOAE and RTOAE. Both options include an automatic probe fit check to verify proper probe placement. Screening results are obtained in as little as 30 seconds for TEOAE and 1 minute for DPOAE, with a display of the passing status for each frequency band. SmartScreener-Plus 2 comes with an integrated system maintenance module, which facilitates system checks for monthly maintenance and troubleshooting. This module includes an automated AEP data analysis report to assist in monitoring program outcomes. Free web auto software updates can be done seamlessly from the module as long as the computer has an internet connection. User can also request supplies and send us a request for quotation right from the machine. The essential components of the SmartScreener-Plus 2 are pictured here. We went over many of the screener card features earlier on, and now we'll take a closer look at the components that make up the system. On the front of the cart is a key that unlocks a technology tray. We recommend keeping the key in a safe place. Inside the technology tray, you will find either the beige USB Lite device or the black Solo box, depending on the configuration your hospital has purchased. On the right, you will find the electrode lead cable that corresponds to each device. The USB Lite electrode lead cable has a black, red, and blue lead, and the Solo electrode lead cable has a red, white, and blue lead. Pictured on the right, you will see the insert earphones and the ear hug adapters with tubing, to which the ear hugs will be attached. For systems configured with the USB Lite, the insert earphone cable and electrode lead cable will be connected to the sound output electrode box on the side of the cart. For systems configured with the Solo, the insert earphone cable and electrode lead cable will be connected to the extension cables on the side of the cart. Always make sure cables are securely connected before testing. As I mentioned earlier, the device can be used even when the screener cart is not connected to power. When the screener cart is disconnected from power, the battery indicator on the top of the screen will be red, and when it is connected to power, the battery indicator will be green. The computer will turn on once the device is connected to power and will remain on until turned off. It is important that the device be plugged into charge whenever it is not being used. We do not recommend testing if the battery indicator is lower than 30%. The SmartScreener-Plus 2 features a user-friendly software interface. The screen is divided in 5 steps, guiding the user through the screening process. Before we go through the screening process, I want to talk about why it is that we do what we do. Hearing loss is quite common. According to the National Institute on Deafness and Other Communication Disorders at the NIH, about 2 to 3 out of every 1,000 children in the US are born with a detectable level of hearing loss in one or both ears. More than 90% of deaf children are born to hearing parents. Our primary goal is to detect hearing losses as early as possible. Studies have shown there are great benefits to early identification. The first 3 years of life are regarded as critical for language development. It is therefore critical to identify hearing impairment as early as possible. Since we can't exactly ask the newborns whether or not they can hear us, we use objective methods to screen for hearing loss. Let's quickly review the hearing mechanism. First, sound enters the ear and travels down the ear canal, which then vibrates the tympanic membrane. This then causes the ossicular chain to vibrate, which in turn vibrates the oval window of the cochlea. Inside the cochlea, there are hair cells on the basilar membrane, which, when functioning properly, will vibrate. The hair cell stimulation causes nerve impulses to be sent to the brain. Different regions of the basilar membrane are sensitive to different frequencies. The nerve pulses travel to the brain where they are interpreted as sounds. There are 2 types of objective tests that are used in newborn hearing screening. The otoacoustic emissions, which evaluate the function of the cochlea, and the auditory evoked response, for example, the AABR, which measures neural synchrony. Nerve impulses can be transmitted from the cochlea to the brain. A stimulus is presented to the ear using an earphone, which in our case, through an over-the-ear ear-hug coupler, and a computer records and analyzes the brain responses from the electrodes connected to the scalp. The AABR response has a very small amplitude compared to the EEG activity, as well as other electrical interference and noise, and so averaging is required to extract these responses. Something else that will be helpful in improving our test sessions when doing automated AABR tests and any other auditory evoked response tests will be controlling our environment as best as we can. The best time to test the baby will be when they're sleeping after feeding. The calmer the baby, the calmer the EEG activity will be. We will also want to make sure that we get a good impedance for the electrodes. Some additional tips including separating the cables from each other. We typically prefer to have the insert earphones coming from the top of the crib and the electrode cable from the bottom. Avoid having cables touch the floor. You can turn off the light so that the baby can sleep more comfortably. No skin preparation is necessary, but make sure the skin is clean before placing the electrodes. Skin that is too dry, too oily, or flaky may affect impedance. Make sure the electrodes are kept in an airtight bag so that they don't dry out. The electrodes are pre-gelled and should not be dry before you start using them. To obtain the most ideal impedance, which is good contact with the skin, IHS recommends the use of SpectraGel in addition to the gel already on the electrode. Place a small drop of SpectraGel on a gauze pad. You can also use the backing of the electrode as a receptacle. Use a small dab of SpectraGel in the center of the electrode sponge. Press down around the sponge to secure the electrode in place. Do not press in the center of the electrode, as this can spread the gel and make the electrode come loose. You'll save that for when you're removing the electrode at the end of the test. Place the electrode connected to the red lead first on the nape of the baby right beneath the hairline. Place the electrode connected to the blue lead on the right shoulder of the baby. If the right shoulder is not accessible, use the left shoulder. The electrode connected to the white or black lead, depending on the model of the SmartScreener-Plus you're using on the forehead, in the center and as close to the hairline as possible. Allow some time for the electrode conductive gel to be absorbed into the skin. This is why we place the electrodes first. The earhugs come as a pair in a pouch. Open the earhug package by ripping the package at the notch, then carefully remove the earhugs from the pouch. Attach the earhug adapter to each earhug prior to removing the clear backing and placing the earhugs on the baby. Use the top of the cart as it is much easier to attach the earhugs on a flat surface. Rotating the adapter while attaching it will facilitate placement. Hold the earhugs with one hand, then peel one side of the clear protective backing from the center and out. Remove the second half of the earhug backing from the center out. Avoid handling the gel area to preserve its adhesive qualities. Position the earhugs over the baby's ear. Align the center of the dome with the opening of the ear canal. Flatten the earhugs to create a seal around the ear. The earhug does not need to stick on the hair or be folded around the ear. It is important to create a seal on the pinna. Since the earhugs are flat, you can certainly place the baby's hat on before testing. Make sure the cables are not touching the floor, that the cables are not touching each other, that your patient is calm and comfortable. Log into the software and launch the AEP screener. It is time to start testing. Once the AEP screener is launched, the user will choose to either enter a new patient by clicking on New or open a patient that has already been entered into the system by clicking on Load. The required fields are customizable and are set up when the equipment is installed. Here, I will enter the last and first name along with the medical record number in the ID field. Clicking on the birth date opens a calendar. Once all the patient information is entered, I will select OK, and the impedance will automatically be checked. The impedance for each electrode will be displayed next to the electrode position on the screen. The system will not proceed with testing if the impedance is higher than 7, and the software will display and play a message whenever the impedance is higher than 7. Since I have placed my ear hugs and the impedances are acceptable, I can move on to step 4 and verify that my patient is calm and ready to be tested. The incoming EEG from the baby will and can always be viewed in step 4. To start the test, I click on both to test both ears. At first, the system will check the impedance again, and once the impedance check is completed, you will see the words ramping appear. We noticed that babies with robust hearing would startle a bit at the onset of the stimulus, and so we decided to have the software slowly raise the volume to 35 dB. This only takes a couple of seconds, but helps reduce the myogenic noise that can come when a baby is startled. We will not see any updates on the screen until 20 sweeps, and the results will update throughout the test every 20 sweeps. The impedance is also checked every 20 sweeps to ensure the electrodes are still securely connected. Next to the number of sweeps, you will see a rejection count. The system automatically adjusts the EEG window to the state of the baby at the beginning of the test. Typically, this artifact rejection window will open from 12 to 20% in a sleeping baby, and anywhere from 20 to 30% for a baby that is awake but calm. If the window is open between 30 and 45%, this means that the recording will be noisier and that the test could take longer. We do not recommend testing if the EEG window is open to 60%. As long as the blue squiggly line that represents the incoming EEG stays in the white area, the sweep counts will go up, which means our test is progressing. Whenever the EEG blue line goes into the pink boxes, the sweeps will be rejected and the rejection count will go up. A good indication that a test is progressing is that the sweep counts are going up while the rejection count is staying low. The minimum number of sweeps for a pass is 80, which is 2 minutes if there are no rejections. When we did a study with about 3 million babies, the average test time was found to be less than 7 minutes. The more rejections, the longer the test. Sometimes the system will reject an entire block of 20 sweeps if it is too noisy. The earliest pass is at 80 sweeps, and when a baby passes at 80 sweeps, you will see the blue and red signal-to-noise ratio bars, or SNR bars, will be completely full. As the system starts making its determinations, beginning at 80 sweeps, the bars will fill, and as the system starts detecting a response. It is important to note that a pass only occurs when the SNR bars are completely full, and the word pass is indicated at the top of the screen. This is the only point at which the system determines a valid response to be present. As the test progresses, the gray and yellow bars will be gradually reducing since the noise is being averaged down. If one ear passes, the system will look at what is going on with the other ear. And if the SNR bar for the other ear that hasn't passed is filled more than 70% of the way, the sweeps will continue to average. If it is not, the sweep count will refresh for the ear that has not passed. Now, starting at 240 sweeps, the system will evaluate the noise conditions. And if no response is detected from the baby, and the system has determined there is no chance of a pass, the system will output a refer. The maximum number of sweeps is 400, which is 15 minutes if there are no rejections. However, if you reach 400 sweeps and the SNR bars are filled 70% of the way or more, and the system determines there's a chance of a pass with more averaging of the noise, 100 sweeps will be added. Once the test is completed, you can choose to print either a medical record form or a full data result form. For the babies that have passed, a certificate button will appear. Once you're finished testing, you can disconnect the electrodes and ear hugs from the baby, dispose of them, and exit. If you are planning on testing another patient, you can simply click on New to create a new patient, or click on Load to open the next patient. You will be able to search for the patient by medical record number or name. You can also click on Look once the patient is open to view the tests that have been done for that patient. Please check the bassinet and the area around the baby to make sure that nothing is left behind, especially the ear hug and electrode plastic backings and the packaging. Make sure to clean and disinfect the cables before carefully storing them on the hooks. Thank you for taking the time to learn about our SmartScreener-Plus 2 automated ABR and OAE screener. Please feel free to contact us if you have any questions or need additional information.